Yeah.
like before.
Yeah.
So now you're happy, right?
Yes,
Good.
thank you.
Thank you very much. See?
But you know, I like it more pictures than natural.
Sometimes patient has the very specific demand, such as they want really thin. It's very thin actually. So they require certain things. It's from my understanding, whenever I saw the patient with the dentist, and then I noticed that patient have something in their mindset, which means it's most of them is right. I would say 70%, but 30% they cannot describe it. So they don't know what to do. Probably they don't trust, something like that, or entire their life, whatever. And also they want to see the seated all the way 24 teeth in their mouth, and then if they change it, a 7-star case, which is I fabricated, which is 2 piece, it's hard to change it, which is time consuming, spend a lot of time. So we recommend them sometimes that we try the frame design, and then top of that we put it into our restorations and put some Vaseline inside, and then have them check up to the occlusion contact, just chew properly, and just make sure the buccal, the facial contour, and their tongue comfortable. Sometimes their tongues is really bothering regarding their pronunciations, or they had the previous temporary, which is really fat. Temporary usually fat, otherwise temporary will get temporary will get break is very easily. Especially these patients lower, only place implant 1, 2, 3, 4 here, right? So patient have to chew this side to all the way here, and whenever other lab fabricated, extended, same as here, extended, put together, when they biting, crack it just like that. So number one reason we're using the Cyton 7-star, even the 4 implant 2 here, and then we extend it to all the way touching the upper contact, which is 24 teeth. It's not a lot. 24 teeth is more than enough, which is patient chew properly. So whenever I show you the have broke the temporary, that's why they kept broken, and patient cannot think properly. That's very psychological issue. I think whenever they made the temporary, okay, so which is I do, I made it a little bit thicker, and the patient have to wear, I mean, a couple months if they have to, 6 months, fine, up to 6 months. And then they have to tell to the dentist what they like, what do they don't like it, so we can repair it or we improve it. But this patient temporary kept on breaking. So that's why they have them come, that we try in the frame design and the top of that bridge, and then we put together, we see what patients like or dislike it. So if they don't like it, and then we just repair it, contouring, teeth contouring, and occlusion contact, color, so we can change that one easily. So after that, we can cement it one piece, which is this mobility is really good, and the tensile strength is really good. So when they put together, pounding together, and there's really good supporting, and then when they chew the cow, I mean meat, or I'm sorry, not chew the cow. So they chew the meat and all hard food, and then easily break it, so they can get as easily can digest it better. That's this benefit, and then no one can make this very thin like that. The full mouth ceramic zirconia. I'm not talking about composite. I'm not talking about denture. I'm not talking about acrylic. I'm talking about ceramic. So that's the key. So we can make the here, and not only that, we make the beautiful aesthetics. Regarding upper, unfortunately, patient has the cement screw, which is just like point is really out, which is we did not make that one. Dentist did not do it, but patient came from other organizations. So dentists have to put the long-term temporary cement in the top. Anyway, stay tuned. My video is more detail. And then thanks for watching. Thanks for my channels. And thanks for following, of course. Have a great day. See you next time.
And do you have gauze anywhere, Luke? Let's see if that'll fit. That's my shortest one. Otherwise, we can just try like mediums and shorts. We'll see.
Trying to get close is not to touching.
Yeah, close.
No, touching. This is touching.
As long as they, that I think we'll be okay there.
I think it's too tight. Let's see. Bite down.
That's good.
Yeah, be careful because they're not in all the way.
yeah.
Yeah. Bite. Smile.
slowly. Yes, we put the Vaseline on the ears. Dr. Jusufi.
Okay. Thank you.
Alright, from the 7-star frame, refiner. Okay, have a little, hold on. Okay, E. Can you E? Make the E. Yes. Bite.
Oh my gosh.
Alright, try. Okay.
Okay, let me put the bridges in place.
Needed to give it a little reset. Just go back as much as I can. Sorry, doctor. I want to get a little lower. Sorry. I want that to fix itself. This will scan the palette as well if you need to scan it.
She does a really nice job.
She's a pro. What are you using in the office, doctor, as a scanner?
I have an iTero now. I was gonna, I've been using scanners a long time, so I just got that a few years back. I used to do a True Def.
Oh,
back in
Okay, so long span pontic. This is a broke tie base. So we have to extend it all the way left and right side. It's very imperative. Okay, so yep, that much is the problem, and this is a problem to get the occlusion contact. Okay, thank you. Perfect. Okay, slides and put it back. And then we screw down. Okay, that's good. All right, please take it out. Thank you.
Light is flickering. One more, Tatiana. Okay.
Great. So open up. Yeah, that was the main issue to hold this. Okay, cool.
the flags.
Good job, Tatiana.
Excellent job, doctor.
Excellent, Dr. Jusufi. Now I would like to get the upper scan one more time,
Okay.
so that we can put together. How can we set up the vertical dimension?
Yeah, keep going. Go a little bit on the side of the, yeah. Just looking for this information. Go over the top a little bit and then go to the
Relax
next.
your lips. Yes, thank you. Oh. Sorry, Tatiana. Oh, oh.
Oh goodness, hold on, let me restart it. It'll still be in there. Give it a second.
Trying to put in the whole temporarily we just wax up and then make a little probe out facially, right? And make her can see what it look like. So this is a prototype. But we're going to modify a little bit. E?
Sweetness.
Smile, yes.
Yes, okay.
It's technically a
Right now
model.
the PMMA is his patient almost approved it.
Looking for.
And then we're going to do
Looking for tissue.
the copy.
You want
What it is.
tissue?
Do you want tissue, Luke?
Yes,
Okay.
absolutely. I need a Woogie too.
Okay.
Then sometimes I see.
I'll have to come
Yeah.
back there.
Yeah, that's good.
I'm debating on if I need to turn AI off or AI on.
Looks like
It's
very
picking up some of the
tissue.
tissue, so I think I'm gonna leave it for now, but
I think it's working.
I gotta go back on that.
Two and then bite again.
well,
So
let's get it what we
go from
can
there.
in this
Mhm.
mode, and then we can change it in a minute. 3, 4, 5, 6. I'm missing one somewhere. I have 3, 6, 8, 9, 11.
5, 6, 8, 9, 11, and 14.
All right, that should do it. So that's the overlay. So now we're gonna do the tissue matching part.
Okay.
Let's do that. I really took off that time. And now we have to get that tissue to align. There it is.
That's cool.
Got it. Yeah, I think we can start scanning from that point if you want.
Okay, this is, we need more of this buckle, I think, yeah. What's, okay, well,
There's a long span, honey, both left and right side, so we have to scan really well.
All right,
with
now I need to get.
the Shining 3D. And the scanner.
Let's reset.
A little bit more further.
I need to get down this way.
yeah, no, yeah, you gotta get that buckle.
All right, I'm ready when you guys are. Maybe we'll have her close a little bit. And let's see if we can get some redirection here. And this is the hard part.
Beautiful. And then
All right, let me
just
try to
take a
get
look,
right
take a
here.
look at it, patient left side, the panic. Can you,
This side, yeah, I'm gonna get more of that.
Ray, you can change that one with the touch screen.
It'll flip. It should flip. I can't see it.
So now lower.
I'm just worried about this being too much data. Because the AI is
Those
not,
purple ones?
well, now, let's just see what happens.
Yeah,
Like before.
yeah.
So now you're happy, right?
Yes,
Good.
thank you.
Thank you very much. See?
But you know, I like it more pictures than natural. Yes.
No, but Tatiana, I don't think you're used to
Maybe
it.
I have now full mouth teeth.
Yes, yes.
Created Dr. Just Fine. Thank you.
Thank
Thanks
you.
for
Thank you,
coming.
doctor.
you.
Thank you. Thank you.
Thank you.
Thank you.
Yeah.
Thank you.
All right, see the more detail.
Yeah, beautiful detail.
Yeah, beautiful detail. Thank you very much.
Thank you, Lou. Thank you, Doc.
Now we can go home.
Fine.
Well, this is the final 24 unit cases. We take over from another laboratory and then make her as happy as possible. and then mounting the custom apartment. And unfortunately, the underneath we have to cover with all metal. There's not much room, so we have to make the shiny as possible. So underneath, and we covered the whole facial area and make some aesthetic as possible. Okay. The good part is just like we usually made it with the great tissue adaptation from the chrome cobalt framework on top of the monolithic zirconia restorations. Like the unit here. Okay, so at the same time, so we finished the lower. It's very thin. Okay, she was complaining about the lingual side because the temporary and then another lab fabricated. She kept saying it's too thick. And this, and then especially here. So this is kept broken. Tooth. Then even this thickness, she's not happy, so we make it thin. That's why we made the chrome covers make thin as possible the lingual area. And also lower, finish them up. So now we're going to cement, either have to try in and or patient's happy or doctor can cement, and then our side. So this is our final restoration will be. It's another beautiful restoration just came out. So I'll share with you guys. All right, stay tuned. Thank you. Well, the other one is also overcoming, but big panic just kept breaking the whole backside teeth. So that's why we decide to go to the Titan 7 stars lower. Otherwise, the cornea will going to break, or they have to make it really thick. Okay. So underneath, same thing. So we made this great. Looks like the teeth. Right here, some of the beautiful restorations just came out. They're seated here.